The fury of the virus illustrates the folly of war. That is why today I am calling for an immediate global ceasefire in all corners of the world.
Millions of people are caught in war zones. The UN says that's preventing an effective response to the outbreak. A bombed hospital can't treat the sick. The virus spreads when tens of millions flee violence in Africa, the Middle East and Asia. In March, the UN Secretary-General called for a global ceasefire.
To warring parties, I say, pull back from hostilities, put aside mistrust and animosity, silence the guns, stop the artillery, end the airstrikes.
But the world responded by buying more weapons and starting new conflicts. The pandemic is set to spark famine, riots, instability and civil war.
The coronavirus has weakened governments and security forces. That's allowed some rebel groups to flourish. They mostly face the same restrictions. Their costs are also rising, but they pass them on to those caught in the territories they hold. Still, as DW's Sikoto Chaya reports, the response isn't that different to that of some governments.
This herd is on its way to the biggest cattle market in the Central African Republic. Here in Bobui, some 42 kilometers from the capital Bangui, where the herds are sold. For traders in this country, it means moving from areas that are controlled by different armed groups. The coronavirus pandemic is an additional problem. These traders complain that many armed groups have taken advantage of this health crisis by levying huge taxes on them.
We face so many difficulties in transporting our cattle from Kagabandoro to the Bobui market. Armed groups attack our shepherds. Before coronavirus, the rebels asked each of our herdsmen to pay between 50 and 80 euros. Now they've increased the fee to almost 125 euros. They demand so much money for taxes, and we're all discouraged.
Life in Bangui hasn't changed much for most people. It is almost impossible to determine who is infected with the coronavirus or not. During the rainy season, people have the flu or malaria, and that in a country where poverty is notorious. It is estimated that about 71% of the population live below the international poverty line. Men and women are fighting every day to get food on the table. So far, there is little progress in the country. We meet Rodriguez Poloko, a young activist. He specially criticizes the government's management of the pandemic.
We're in a country where we no longer understand anything. In the beginning of the coronavirus pandemic, we were told that with all the donations that the government had received, COVID-19 won't be a problem. The test was free, for instance, but now we have to pay for the test, almost 30 euros. Who can pay that? It's an unbearable situation for Central Africans.
In addition to the security and economic impact of the corona pandemic in the Central African Republic, there are more than 4,800 confirmed cases. And in the midst of all this, the measures put in place by the authorities to fight against this virus are no longer respected in public places.
Just one example of how rebel groups are ruining people's livelihoods and how some governments are failing to keep promises. Let's bring in Matthias Bazadau. He's director of the Giga Institute for African Affairs. Has the coronavirus led to more conflict or unrest in Africa?
That's a very good question. My answer would be yes and no. There has been some limited increase in terms of violence, what can be called so-called COVID-19 disorder. This is mainly when people riot because of access to nutrition and so on and so forth, or when there's political repression by government authorities. On the whole, however, large-scale violence has not really increased. At least that's not what the number tells us. What we believe is that more massive violence can happen in the future, but only after a period of incubation, especially when economic consequences get really really, really bad, and when there's poor management of the resulting conflict.
Well, picking up on those restrictions, you've said there are certain kinds of conflict that pandemic restrictions are more likely to aggravate. What sort of conflicts?
Especially at the beginning, you have, people are reacting directly to what the governments are doing. For instance, if we have lockdowns, restrictions, social distancing, people might not be happy with it because they feel they cannot, get food on the table, as it was mentioned in the report before. And that, of course, has happened, for instance, in South Africa, where there was a quite, strict lockdown. On the other hand, people might be scared that they are exposed to a high risk of infection, for instance, like in Côte d'Ivoire, when a testing center was destroyed because people were scared. However, this kind of violence, is limited in terms of intensity. Other forms of violence are more likely to happen in the more distant future and under unfavorable circumstances. One specific risk could be when economic conditions become really bad, that vulnerable minorities, especially migrants, might become scapegoats. I think South Africa could be an example of that. Also, in ongoing conflicts, you have a risk of escalation. But again, the numbers do not show a strong increase as of yet.
And we should point out here, of course, that the pandemic has tamed some conflicts.
Yes, indeed it has, although I would be a little bit cautious with regard to that as well, of course. Generally, I think natural disasters have the, kind of power to bring people together because there's a common threat and they rally around the flag, stick together rather than protesting against it. However, this effect, wanes after a while. And we have seen it also in the report that some of the people get more and more dissatisfied. You see it around the world globally. A more concrete example of a taming effect of the pandemic was in Cameroon. We have a secessionist conflict in the Anglophone part of it. And one rebel group there has announced a ceasefire, explicitly mentioning the pandemic as a reason. And as we speak now, I don't have very, very good information, but the government is secretly negotiating with the rebels. So I'm not exactly expecting that the pandemic will solve the conflict, but there's a window of opportunity here.
So how do you get the balance right? Containing a virus, locking down an economy, and preventing conflict?
Actually, that's an excellent question. Maybe it's the $1 trillion dollar question, if I may put it this way, because that's exactly the key challenge. On the one hand, keeping the virus at bay, and on the other hand, avoid that you harm the economy so hard that the medicine will be worse, than the disease. So, and unfortunately, you want to restrict the virus, we have to take measures that harm the economy. And one idea I have in this regard is that Africa was hit later by the virus, and that of course offers the opportunity that Africa can learn from other countries how to do it the right way.
Matthias, we'll have to leave it there. Thank you very much for being on the show today.
Yeah, thank you so much. You're welcome.
And time to answer your questions on the coronavirus. Here's our science correspondent, Derek Williams.
Why is vitamin D not being promoted more, since there's the evidence that its deficiency compromises the immune system?
There's been an ongoing discussion in the medical research community for many months now about whether or not vitamin D, or more precisely, vitamin D deficiency, could be playing a role in COVID-19 outcomes. Lots of people don't get enough sunlight to produce sufficient amounts of it themselves, which is why claims have multiplied that supplements of vitamin D help against SARS-CoV-2. There's clear evidence the micronutrient is important to healthy immune system function. In other words, to how susceptible you are to infection in general. A recent study from the University of Chicago went a step further, looking at patient records. The research team there discovered what they claim is a clear retrospective link between vitamin D deficiency in patients and COVID-19 risks. The problem is that to prove it, we still have to carry out what are called randomized trials, where we'd monitor people getting enough of the vitamin and those with known deficiencies, and then track the groups to see what happens over time, whether there are differences in how many people in the cohorts contract COVID-19, and if they do, how severe it is. Another issue, though, is if vitamin D really does prove to be an effective preventive measure, what doses of it should people take? Taken in excessive amounts as a supplement, it can cause calcium to build up in your blood and can even cause organ damage. So there are potential dangers along with the upsides. But in general, the experts agree that taking a supplement in safe amounts recommended in national guidelines can't hurt your health, and it might help it, especially if you have a known vitamin D deficiency.
Finally, in his general audience on Wednesday, Pope Francis said we need to heal the world from the suffering highlighted by the pandemic. He said the coronavirus has exposed the great inequality that reigns in the world, the inequality of goods, healthcare, technology, and education. The pontiff called for policies that reward participation, care, and generosity, rather than indifference, exploitation, and special interests, saying a fair and equitable society is a healthier one.
We will be able to regenerate society and not return to so-called normality, because this normality was sick, also before the pandemic. A normality of injustice, inequality, and environmental degradation.